What's up, Doc? Delivering Service Excellence in Health Industry, a lecture given in June 22, 2012 to MBA students from all the programs of Ateneo and medical students from Ateneo School of Medicine and Public Health. Thank you for your kind introduction. Good evening to everybody. Before anything else, I'd like to thank the organizers of this forum for inviting me. I consider the invitation foremost an honor and privilege, and secondly, an opportunity to learn with you as I prepared for my talk and as I listen to the other panelists and as I try to answer your questions later. You asked me these questions. If you don't mind, I will change it to what's up, Dr. ROJoson. What are your thoughts, perceptions, opinions, and recommendations or TPORs on delivering service excellence in health industry in the Philippines with focus on hospitals? In consideration of the goals and objectives spelled out by the organizers and in consideration of the time allotment, I will delimit my TPORs to these 4 questions. When does one say there is service excellence in health industry, in the hospital industry? What are some recommended strategies for delivering service excellence in the hospitals? What are the most difficult or outstanding challenges? I will also try to answer the questions posed to me by the organizers. Here they are. I will now start answering the first question. The health or medical industry is a sector within the economic system that provides services and goods to people with health concerns. The health industry is a conglomeration of all these offices and players. Examples are the Department of Health, the hospitals, the pharmaceuticals, the doctors and nurses, insurances, medical schools, etc. The health or medical industry is expected to deliver in a collective effort an excellent services and products to the community. The question is, what criteria and indicators do we use? My most difficult or my most direct answer to this question is to look at the current healthcare outcomes of the catchment community of the health industry, such as the Philippines, a province, a city, etc. Examples of criteria for healthcare outcomes are the average lifespan, infant mortality, and maternal mortality rate, control of specific diseases, quality of life index, access to healthcare with their corresponding indicators. The question to ask is, are the set and agreed indicators being achieved or not? If yes, the whole health industry is delivering excellent services. If not, it is not excellent or not so excellent. I'm done with the first question. I will now go to the second questions. Hospitals can and should contribute to the achievement of the targeted health outcomes in their catchment community. They should coordinate and collaborate with the national and local government health departments. They should come out with structured programs to achieve the targeted healthcare outcomes of their catchment community that are aligned and integrated with those of the government health departments. They should track and evaluate their outputs. And these activities, if present, constitute the foremost evidence of service excellence for the hospital. The practice of medicine is now evolving from simply cost effectiveness, efficiency targets, quality and safe targets, evidence-based medicine, to a higher level of service excellence, that is of the value-based medicine, a concept popularized by Porter and Tastebergs. Here are some principles of value-based medicine or health services. The focus is on value. Value is created for and appreciated by patients served and for services rendered. Value is health outcomes achieved per peso spent, not just access, convenience, volumes, and cost containment. In other words, there must be good results on community and individual patient indices and quality and safe services with reasonable costs and expenses. At this point, I will share with you some results of a survey that I did in 2010 on the perception of 141 hospital administrators, physicians, nurses, and patients on what constitutes an excellent hospital. In the table are the top 5 parameters of excellence as perceived by the different stakeholders or stakeholders. Note the ranking of the affordable, reasonable hospital, medical cost. Note the presence of quality expectations from stakeholders from 3 to 5. If we combine the expectations in rows number 1, 3, 4, and 5, we can deduce that the stakeholders wish for value-based services somehow. In this table, one sees in the number 2 slot with financial sustainability program as a parameter of excellence. To this, I agree, and this is the third criterion that I will use to say that a hospital is an excellent hospital. Excellent hospitals are those that are managed to be sustainable over the long term, say at least 100 years or longer, while providing excellent services. Sustainability of a hospital is dependent on both financial and non-financial factors, for which I will use the terms financial sustainability and management practice sustainability, respectively. The simplest indicators I will suggest using for financial sustainability are the following, or the following summary values, which are constantly positive net income, constantly adequate liquid asset, constantly manageable debt burden. For the management practice sustainability, I will suggest the use of Baldwin's healthcare criteria for performance excellence, quality and safe patient care standards as those of the Joint Commission International, Accreditation Canada International, and Field Health Ben's book, and also investors in people. There are at least 4 programs to develop with regards to sustainability. The ultimate goal of the business development program is maximal utilization of services being offered. For the financial management program, no unwanted losses, and with enough revenues and income to continue operations of existing services and to expand when needed. For business continuity, to be able to continue to operate after an unavoidable incident or business disruption, such as a fire or earthquake disaster. For corporate social responsibility program, to contribute to the sustenance of the catchment community of the hospital, as sustainability of the community will invariably affect the sustainability of the hospital. To summarize and repeat, my key indicators for excellent hospitals are the following: contributing to the achievement of the targeted health outcomes in the catchment community, providing value-based healthcare services, sustainable while providing excellent services. I will now go to the third question, which is the recommended strategies. The strategic framework consists of the following: set the 3 key indicators of an excellent hospital as goals. Design and development a hospital performance excellence program, always using the 3 key indicators as the steering wheel. Get committed support of top management and staff. Implement the program perseverantly. Evaluate the results of the implementation. Continually improve the program until the 3 indicators of performance excellence are achieved to the highest degree. To the strategic framework, I suggest using the following facilitating strategies. Baldrich's criteria for performance excellence, Joint Commission International or Accreditation Canada for hospital accreditation, and PhilHealth Benchbook in the design and development stage. Investors in people in the implementation step, balance scorecard in the evaluation step. Note, one needs not go for accreditation to all the standards. What is more important is to be able to use them as guides in implementing and evaluating the hospital performance excellence program. What is the Baldrige Healthcare Criteria for Performance Excellence? This is a United States-based standard that is designed to help hospitals use an integrated approach to organizational performance management that can result to delivery of ever-improving value to patients and other customers, contributing to improved health care quality, improvement of overall organizational effectiveness and capabilities as a healthcare provider. The standard contains questions and guides on how to achieve performance excellence. This shows the framework using the systems perspective with emphasis on alignment and integration of processes. What are these three standards currently being looked at by hospitals? There are all hospital patient care standards. They are being used to accredit hospitals for quality and safe patient care. All of them have both patient-centered standards and hospital management standards. JCI is based in the US, while ACI, Canada. Of course, PhilHealth's Benchbook is Philippine-based. What is Investors in People? It is a business improvement tool designed to advance an organization's performance through its people. The standards originated in Great Britain. The framework involves plan, do, and review with 10 strategies that include learning and development, people management, recognition and rewards, involvement, and empowerment. These standards is relatively easy to use as a guide in managing people in the organization. What is a balanced scorecard? It is a blueprint formulated by an organization to be used as a guide and reference for one, implementation of strategies and tactical objectives, monitoring, evaluation of actions taken. It is not only a management strategic tool, but also a performance measurement system. The BSC was popularized by Kaplan and Norton with 4 perspectives: financial, customer, process, learning and growth. The scorecard is called balanced because it coordinates or it considers for all the factors, the 4 perspectives that are important in achieving the vision mission of an organization, not just the financial factor as is commonly done in business organizations. Manila Doctors Hospital has been using the balanced scorecard since 2004. In 2008, it added the corporate social responsibility as the 5th perspective. This shows a sample of the balanced scorecard of Manila Doctors Hospital. Have the vision, financial perspective, goals, tactical objectives, performance measures, and targets, initiatives or programs that will be used to achieve the goal, objectives, and targets. Continuation of the balanced scorecard showing the customer and process perspective. Then people and corporate social responsibility perspective. In an evaluation done in 2011, Manila Doctors Hospital claims that the balanced scorecard has been useful in serving as a communication, alignment, collaboration, monitoring, and evaluation tool in the implementation of its strategic direction. I will now go to the 4th question. There are a lot of challenges in the delivering service excellence in hospitals. The traditional ones, as seen in the table, are categorized under man, method, money, machine, monument, and rapidly changing trends in healthcare. The most outstanding challenges are establishing alignment, integration, coordination, collaboration among and between the hospital and the health industry, the hospital and the community, the hospital and the accredited physicians, the many interfacing departments and units within the hospital, and the thousands of workforce or staff within the hospital towards achieving the goals and objectives of the health industry and the hospital. The most difficult challenge is how to manage the people with different mindset and behavior, particularly in the face of a paradigm shift towards community health outcome targets, value-based delivery system, and corporate social responsibility. My recommendation, the facilitating strategies that I mentioned earlier, that is the use of established standards, the investors in people standards, and the balanced scorecard, plus the following generic strategies that can be used to meet the challenges: leadership, managership, communication, and education. I'm done answering the 4 questions that I posed. On the questions posed by the organizers, I think I have somehow directly or indirectly answered them when I was answering my own questions. If I left out anything, I would be glad to answer them during the open forum. This is one additional topic that I was asked to give my TPORs on the hospital's medical tourism program. One, a hospital can have a medical tourism program as long as it does not target or it does not forget its primary responsibility as its nearby society or its catchment community. Second, a hospital that is considered excellent based on the 3 key criteria I mentioned earlier, and one that is compliant with the Baldrige criteria for performance excellence, international patient care standards, either those of the Joint Commission International or Accreditation Canada International, and the PhilHealth Benchbook, can attract international patient clients to its premises, either as part of the medical tourism program or outside it, meaning foreigners who got sick while visiting the Philippines as tourists. These are my general TPORs on the hospital medical tourism program. To the organizers, with the questions you posed to me, I can feel you want me to share the practices of Manila Doctors Hospital, my base hospital, with regards to service excellence. Let me just say that Manila Doctors Hospital is still in a journey towards excellence, performance excellence. It formally started in 1999 with a clear vision and mission statement and a mission to pursue corporate social responsibility. A balanced scorecard was used starting 2004. An ISO accreditation was obtained in 2005. Investors in people was being used starting 2007. Baldrige healthcare criteria for performance excellence was being used starting 2009 as a guide. PhilHealth Benchbook Center of Excellence certification was obtained in July 2010, and then Accreditation Canada International in December 2010. Social vision was formulated in late 2011 and formally launched first quarter of 2012. For the next 3 years, MDH's strategic direction is integrated value-based health services. I hope this slide contains the key information that you need from Manila Doctors Hospital, and you can see they are reflective of my thoughts, perceptions, opinions, and recommendations on service excellence in hospital industry. In summary and closing, I've done all these things as I promised at the start. I feel this is the most important take-home message, the key indicators for performance excellent hospitals. Number 1, contributing to the achievement of the targeted health outcomes in their catchment community. Number 2, providing value-based healthcare services. And number 3, sustainable while providing excellent services. Before I end, if you don't mind, I'd like to add one more take home message and one advice, especially for those who are in the health and hospital industry. Why deliver excellent service in health industry? First, obligation. Health industry and its components owe it to the clients they have decided to serve. They should do what is right for their clients. Two, or second reason is sustainability. With excellent service, with value-based services, there'll be more clients, there'll be maximal utilization of services, and in the end, there'll be enough revenues and incomes to continue to operate and to expand when and as needed. With a social vision, with a corporate social responsibility, there will be sustainability of the catchment community, and in the end, sustainability of the hospital. The advice for those who will manage a performance excellence program in a hospital, I advise you to start early as the journey is long and tedious. You have to be very, very perseverant as there are a lot of challenges and things to learn. On that note, I end my presentation with an appreciation for your patience in listening to me. I hope I have added new things to your stock knowledge. If you want to continue interacting with me, here is my cell number. Thank you.